Hello guys, this is me Dr. Kashan Kasit today here, and we are going to discuss today the clinical features, signs and symptoms of HIV AIDS. But before going to discuss the lecture, just go and click on that bell icon so that you can get my notification later. So let's begin with the topic of HIV AIDS. The clinical picture of this disease can be divided into three stages. Number one is the acute stage, then is the middle stage, we call it chronic stage, and the final one which is full-blown AIDS stage. So these are the three stages, starting with the first one, that is early acute stage. This stage begins 2 to 4 weeks after the infection, and there will be the clinical feature of number one here is fever, lethargy, sore throat, and lymphadenopathy. There can also be a maculopapular rashes on the skin, which is usually seen on the trunk, legs, and also on the arms. So these are the clinical features seen in the first stage. In this stage, initially there will be a decrease in the CD4 count, and there will be the rise of CD8 T cell count, which is usually due to fighting of CD8 T cells against the HIV virus. In this stage, the symptoms usually resolve in 2 to 3 weeks spontaneously. In this stage, the CD4 count usually ranges greater than or equal to 500 cells per micron liter. This is the range of CD4 T cells in this stage. So this is the first stage. Next we are going to discuss the middle chronic stage. Here is the second stage, we called it middle or chronic stage. Depending upon the immune system, this stage can continue as long as 10 to 12 years. In this stage, the body is actually fighting against the virus, and there will be the decrease of CD4 T cells, and there will be the rise of CD8 T cells. These CD8 T cells are actually fighting against the HIV virus. So in this stage, there can also be a latency, we call it latent stage, and the patient may remain asymptomatic, but there can also be a syndrome we call ARC. And during this ARC syndrome, patient can also present you with the following features. Number one, here is the persistent fever. The second one is fatigue. Weight loss is most important here, and the generalized lymphadenopathy. So these are the clinical features of second stage. Next we are going to discuss the last full-blown AIDS stage. Here is the last stage, we call it full-blown AIDS. This stage can last for 7 to 10 years, and this can culminate in death. So in this stage, there is markedly reduced CD4 T cell count. This usually ranges below 200 cells per micron liter. So CD4 count is markedly reduced in this stage, and there is an increase in frequency and severity of the opportunistic infections. To most frequently occurring infections or the clinical feature or manifestations are, number one here is the pneumocystis pneumonia, and the second one is Kaposi sarcoma. So today we are done with the signs and symptoms of HIV patient. Next we will discuss the diagnosis and the treatment plan for this HIV AIDS. Hope you like my video. Thank you very much for watching. I'll see you in